If we were to see any concerns that would have come up over the last week with Carl, any change in his status or symptoms that we may need to address, we would first talk it over with the team leader here at the nursing home, have them come and observe those things too and see what they had been finding over the week. We would then call the medical attending physician for Carl and get any medicines that he might like to, or his medical input that he might like to give us, any changes in medicines. And then of course we would leave a report for the whole team regarding any change of status that we would see with Carl. We would notify them of any medicines that had been added or deleted and just an overall status update. Sometimes it requires an extra visit from the social worker, or maybe an extra visit from our spiritual care person. Or maybe we've had some pain issues that have arisen in the last week, and then we would make a massage therapy referral. Any of those things would be available and can easily be accommodated throughout the course of the next week before the next visit. I don't have to do that.
Nope.
Okay, great.
Nope.
One difference we would find in doing an assessment for someone with Carl's abilities and or disabilities would be that we would maybe, if he was able to transfer with just the assistance of one, I would transfer him into bed and take a good look at his skin on his back and over his buttocks to make sure there was no new red areas or any places of need and concern. If we have someone who already has a predetermined pressure sore or pressure ulcer, then that goes along with every nursing assessment to find the assistance we need in putting him back in bed, laying him on his side, and making sure that those skin concerns are being addressed and that things are improving from week to week. But overall, Carl has very few physical discomforts. He does require help in all of his activities of daily living. He has the incontinent for elimination, and they are very good about toileting him and changing him every couple of hours. And there was a noticeable change in behavior yesterday with Carl, and he was seeming uncomfortable, being more verbal, and so we did do a urinalysis yesterday to rule out a urinary tract infection, because we need to make sure that there are not valid reasons when we see behavior changes and increased anxiety or irritation in our patients who cannot otherwise verbalize for us. There are several things that we need to address as well within this assessment, and those are things that we maybe need to gather from the chart or from the nursing staff when the patient cannot verbally tell us how things are going. But one of the big concerns for our patients would be constipation. That is something that can cause immediate changes in mental status and agitation and aggression, and it can also lead to a lack of an appetite as well as increased nausea. So constipation is something that hospice addresses very aggressively, along with pain. It's right up there besides pain. So we would look at his BM record and make sure that that was all very regular, because it is a real problem in the elderly for certain. And we treat that aggressively. As well as I mentioned, the urinary symptoms that we continually look at, as well as their sleep patterns. If their sleep patterns change and our patients become sleep deprived, then they have very fitful days if they're not getting good, sound nighttime sleep. So that's another real indication for behavior changes in the elderly, and especially in the nonverbal patient. So we really try to pull the whole picture together and just focus on the overall comfort level and the appearance of being comfortable and having good quality days, quality of life for our patients, no matter where they live and no matter what their abilities are.